Are you thinking about Medicare Supplement Plan N for your supplemental coverage, but unsure about the copays and what else Plan N doesn't cover? In this video, I'm going to go over all the ins and outs of Plan N and even some things not many people know about. So make sure you watch until the end. Hi, my name is Alex Wender, founder of Blue Wave Insurance Services. Over the last 10 years, my team and I have helped thousands of Medicare beneficiaries across the country choose the right Medicare plan for their needs. So Medicare Supplement Plan N is one of the two most popular Medicare supplement plans being offered right now. Next to Medicare Supplement Plan G, Plan N covers just about the same things as Plan G. The Part B deductible is not covered on Plan N, just as it's not covered on Plan G. And the Part B deductible for this year is in the description below, so make sure you check that out. So Plan N and Plan G both do not cover the Part B deductible. In addition, Plan N doesn't cover a few other things. So let's take a look at the chart here and we'll go through one by one what Plan N does not cover, or what it does cover. So Plan N has a $0 to $20 copay at the doctor. So 0 to $20 meaning you're never going to pay more than $20 at a doctor or a specialist. It has a $50 deductible at the ER. If you're admitted into the hospital, that deductible is waived. So far we've got a $0 to $20 copay on Plan N and a $50 deductible at the emergency room unless you're admitted into the hospital. Now going down the list here, we also have, like I said, the Part B deductible not covered under Plan N, just like Plan G. One other thing Medicare Supplement Plan N does not cover is Part B excess charges. Now these excess charges can be confusing, so I'm going to break it down for you so it's easy to understand. Part B excess charges occur or can occur if you go to a doctor that has not already agreed to accept Medicare's billing terms. So it doesn't mean they don't take Medicare, it just means they haven't signed off and said, yes, we're going to agree the Medicare approved amount. Instead, they can overcharge the Medicare approved amount by 15% on the Part B services, which is doctor and outpatient services. So on Plan N, it is possible if you go to a doctor that has not already agreed to accept Medicare's billing terms, they could overcharge by 15%, and on Plan N, you could be responsible for that. I'm going to show you a real easy way to avoid that. Jump on to Medicare.gov, you put in your doctor, you find your doctor, and you look for this little thing here that says accepts Medicare assignment. If your doctor accepts Medicare assignment, you'll never see an overcharge or an excess charge on Plan N. So it's extremely easy to avoid if you can just go on Medicare.gov and make sure they take Medicare assignment. You could also call your doctor and ask as well, but I prefer to see it in writing, so going on Medicare.gov and seeing it there would, I think, be better than calling a doctor. So far in Plan N, we've covered the $0 to $20 copay, $50 at the emergency room unless you're admitted into the hospital, the same Part B deductible as Plan G, which is in the description below for this year, and Part B excess charges, which are not covered under Plan N. Now let's talk about something that not many folks know about when it comes to Plan N copays. Now per this document that was released by CMS, or Center of Medicaid Services, it states clearly that telemedicine has a $0 copay on Plan N. Not many people know that. They might have a Plan N and then they don't know it has a $0 copay on telemedicine until they actually have a telemedicine appointment. So keep that in mind. If you're doing a lot of telemedicine appointments, there's no copay on Plan N. So it's a big plus. Another great thing about Plan N is it tends to have lower rate increases than Plan G. Now, a reason for that is probably because Plan G is the guarantee issue plan, which means if you're coming off a group plan or you've lost a Medicare Advantage plan because you've moved out of the service area, you're able to get a Plan G without having to answer any health questions. But if you were in that same scenario, you lost a group coverage, you missed your open enrollment, or you moved out of a service area with an Advantage plan and you were eligible for a guarantee issue, the only way you could get N is by answering health questions and getting approved if you're healthy enough to get the Plan N. So what that means is Plan N probably has more healthy people on it than Plan G, which translates into lower rate increases over time because the insurance companies don't have to keep increasing rates to keep up with all the claims. So in our experience, we've seen lower rate increases on Plan N across the board, across all carriers versus Plan G. So it's another great advantage to a Plan N. So overall, Plan N is a great option. If you're not going to the doctor a ton, you still have the same coverage in the hospital as Plan G. So if you were on like chemo, dialysis, you had surgeries, cover the same as Plan G, but you're going to have a lower premium and you're going to have more stable rate increases over time. If you're looking for a quote on Plan G, give us a call at the number below, or you can book an appointment using our link in the description below. You can talk directly with one of my team members, get a personalized quote on Plan N, and get all your questions answered. If you're looking to learn more about Plan G, check out the link here and watch the Plan G video and drop a link or drop a comment below on what you think of the video. See you on the next one. Thank you.